Hello and welcome everyone. My name is Jonathan Banks and I am a third-year DMD PhD student at the UIC College of Dentistry. Thank you for joining us for this groundbreaking video series where we will showcase some of our pioneering research experts and their exceptional research topics. As a student researcher, I've witnessed firsthand the research excellence at our college, and it is our privilege to share that with you today. Now, it is my pleasure to introduce Dr. Luisa DiPietro, Professor and Director of the Center for Wound Healing and Tissue Regeneration, who will be sharing with us her insights about wound healing and the lessons we can learn from the mouth. Dr. DiPietro.
Thank you, Jonathan, and welcome everybody. Several years ago, I was on a trip in the Netherlands, a biking trip with my husband. And if you've ever been to the Netherlands, you know it's a wonderful place to bike. The whole country is filled with bike paths. So we were on the third day of a multi-day trip when we came around a bend in the path, and before us was a series of windmills. And I quickly became very mesmerized by these windmills. They were turning, and they were the first windmills that I'd seen in the Netherlands. And I got very distracted. I just couldn't take my eyes off of them. And what I didn't notice is that at that moment, in the middle of the bike path, a post had appeared. And I hit the post, and I tumbled off my bike. When I got up to assess the damage, I found that really it wasn't very bad. It was confined to my left hand. And I just had some scrapes and minor abrasions. So we biked to the next town, got some bandages, bandaged my hand up, and continued the trip. And then, of course, you know what happened. What happened is I healed. And this incredible property that we have of healing is something that we take for granted most of the time. But think for a moment of what it would be like if you couldn't heal. If you couldn't heal, you would be covered with scrapes and cuts like this, and maybe worse. Many of them would be painful, and all of them would leave you susceptible to infection. So the ability to properly heal is essential for human health. Our skin usually heals very, very well. But if you get a large injury, such as a large surgical injury, a traumatic injury, or a burn, your skin tends to heal with a scar. And these scars can be very devastating, emotionally and functionally. To learn more about why skin scars and to see if we might be able to treat skin so that it wouldn't scar, we began studying a tissue in your body that heals very well, very quickly, and with very little or no scarring. And many of you may know that the tissue in your body that heals the fastest is the tissue inside your mouth. It's called the oral mucosa. So oral mucosa lines the inside of your cheeks and the roof of your mouth, and it is able to heal very quickly. If you've ever had a pizza burn, you know that you heal that extremely fast, and that's a good thing. You might wonder exactly how much faster the oral mucosa heals, and that's shown here in this diagram. So here are two equivalent size wounds, one in the skin and one in the mouth. And in a minute, I'm going to show you their relative healing rates. And although this is a cartoon, what you're seeing really is derived from many experiments we've done to look at the rate of closure of wound healing in these two tissues. So now let's watch them heal. What you can see immediately is that the oral mucosa jumps out ahead. It begins to heal very quickly. And the skin takes a bit of time to even get started, and it heals much more slowly. So the next question that you would ask is, why does the oral mucosa heal so much faster? And to answer that question, we have to dive deep into the cell to understand how the cell is responding to its environment. Cells are constantly able to sense their environment, and one way that they can respond to their environment is by turning genes on and off. And when they turn genes on and off, that changes their behavior. So in the oral mucosa, when the cell detects an injury, it begins to turn on or activate a series of genes in a very specific order. And once these genes are activated, the cells of the oral mucosa multiply very rapidly, and they heal the wound. In contrast to these cells that we find within our mouth, cells of our skin do not activate this same gene pattern, and so the skin heals more slowly. So knowing this, we asked whether we might be able to change skin cells to make them heal more like oral mucosa by adding some of these activated genes from the oral mucosa to the skin. And so we took cells from the skin and we loaded them with those activated genes from the oral mucosa. And then we asked whether this activation and adding these activated genes would improve the healing outcome for these skin cells. So now again, we're looking at the same 3 wounds, again a cartoon, again derived from experimental data. And here we have the skin, the mouth, and then we have the skin that has been treated with these activated genes that are found in oral mucosal wounds. And now let's watch these tissues heal. And what you can see here is that now it healed almost as quickly as the oral mucosa. And this is very exciting because it tells us that perhaps someday we might be able to activate the skin and make it heal more like oral mucosa. This holds the promise for treating patients like this who might have a severe injury and would end up with a scar. Instead, a patient like this could be treated at the time of injury with those activating genes from the oral mucosa, and perhaps then they would heal perfectly. And who knew that cells within our mouth, the cells of the oral mucosa, cells that spend their entire life covered in spit, would have so much to teach us about how to prevent scar formation in skin? Thank you.